Hey guys, welcome back to Closely Prescribed. We're here going to talk about our time in surgery clerkship. Again, I'm Robert.
I'm Daniel.
And we're hoping you will enjoy the conversation. Okay. All right, dude. We made it. We finished our MBA exam.
I don't want to get ahead of until I get a passing.
That is
score,
true.
I'm gonna say I made it. But
We haven't successfully gotten our email saying that we passed our final test, but we have completed 12 weeks.
That's right.
Surgery.
Yeah. The rotation part is done.
Yeah. So basically, to give an example of what we've been doing is we've gone into the hospital and we have followed a surgeon, or we have, in my case, followed some just physicians. Particularly emergency medicine and anesthesiology, and just getting the experience of what it's like to be a professional in that space. And we've done this while we have been studying for our national NBME board exam to pass the clerkship course. So, how do you feel about that, man?
I guess I'll start with the rotation. I found that very fun. I was quite surprised. I had no interest in surgery before this rotation, and I'm still probably not going to do surgery. But
well,
I found it very cool. I don't know. I think just lifestyle factors were there. I think a lot of surgery was very research focused. Okay. Maybe obviously you can private and stuff after, right. I guess for myself, I know research isn't really a route that I want to pursue quite as heavily as surgery emphasized.
Right, yeah.
And also I found my emergency medicine time my favorite. So I didn't say I don't want to do surgery because I hated it. It was just more I prefer this other path. But no, surgery definitely got up on my list of things I'd want to potentially pursue.
Yeah.
But the rotation was really cool. I think trying to balance studying with the rotation is where things get tricky. Saying studying for the shelf, it's sometimes be hard to find time for that. But the actual shifts and stuff, what you're saying, following the surgeons, that was very, very cool. And I thought one thing that was interesting about the way the rotations worked was how everyone's was so different.
Very much so.
Yeah, it just depended on what you said you were interested in. So having people doing anesthesia, other people doing vascular surgery or neurosurgery. In my case, I was doing trauma surgery and general surgery, and that was so cool. Trauma surgery sounded cool, but I'm okay, let's not get ahead of myself. Maybe in how it looks in real life is different, but it was just I felt like I was in the movies or something. That stuff was so cool.
Okay, right. Yeah.
So you've woken up at 4 a.m. in the morning, you're getting back, it's 7 p.m, and you think, oh man, I still got to do all my questions, watch the lectures, do my reading, read up for cases for the next day, and then also try to find time to sleep. That's where things get hard.
And for my case, I know a lot of people, and you particularly, had some physician that you followed specifically around with.
Yes, yeah.
I didn't. I mean, with emergency, I had a slew of physicians that I just hung out with and would come and work and follow depending on when they were on call or when they were actually in the emergency department. And then when I was with anesthesia, I hung around the different residents. And so I'm in different OR rooms looking at different procedures. I'm at different types of anesthesia. So I did intensive care unit. I did the pain clinic. I did the OR, the operating room. I've done the outpatient center. So I had different experiences with it, but I was never one physician, one attending that I focused and spent my time around.
Did any of your individual rotations, so I guess for the viewers, for clarity, it's a 12-week rotation, but within those 12 weeks there are different segments. So I do say 3 weeks in the emergency department, 2 weeks in trauma surgery, a couple weeks in vascular. It's not just 12 weeks on one particular service.
Right.
So did you get any exposure with one of those mini rotations where you're following just one surgeon?
I did with ortho. I didn't spend too much time in the OR there though, because he only had one OR day. And so when I was there, and I was only there for 2 weeks, so I only had 2 OR days, and he had like 2 surgeries one day and then had like 3 the next. And I only scrubbed in for like 1 of them for each week. So it was a very limited surgery experience, but I did get to see a spleen and bilateral kidney retrieval at like 3 a.m. One time. So it was kind of cool to actually see that. And I was scrubbed in and I'm, holding the heart with my hand while it's beating. And then all of a sudden it stops and then they cut the aorta and then like blood is flying all over the place. Like it was great. It was a lot of fun. And I did see like surgery on the micro scale. So in like trauma, we're not actually in the OR, but we have to do certain surgical things in the emergency room because this person is either bleeding out or we need to stop infection exposure, or just things that need to be done immediately that we can't really go to the OR for. Okay. So I had it's kind of like a different experience than I guess what the more traditional one would be.
I'd say mine was more traditional. I'd say when I was in the emergency department, it was more just whichever physician was there for the day.
Yeah.
But for my surgery experience, it was more like, this is the surgeon that you're with for the 2 weeks, 3 weeks, or however long.
Right.
And I quite like that just because, a lot of surgeons are like intimidating people, especially if you're like, this is our first rotation, so I'm really just like a baby and I'm just focusing on how to not just embarrass myself a lot of times.
Yeah, because they'll ask you questions. They're like, well, what is this? And you're like, okay, I need to give an accurate answer and I can't just say I don't know, or else they're going to look at you like, you're an idiot. Yeah. And they're going to give you like I don't know about his intelligent level evaluation.
I'd say my advice is that you will embarrass yourself. Yeah. So don't focus too hard on trying to avoid that.
Yeah.
I'd say just show genuine intent. And it was pretty cool like being with surgeons for a long period of time, because for the first couple of days I'm a bit like uncomfortable, uneasy, trying to make sure he doesn't think I'm just an absolute idiot.
Yeah.
But then all the surgeons that I had followed were so interested in like making sure that I learned too. So at times they're asking you questions, putting you on the spot. It's a bit humiliating when you get it wrong, especially if it's in front of everyone. But they're also trying to make sure that you know what's going on, and that is a good way to motivate someone to learn too. I mean, different people have different ways they find that like intrinsic motivation, but I think like fear of humiliation I think is a pretty good one.
Yeah, it's true.
I think that helped me learn anatomy very thoroughly. So
I agree.
The past, yeah.
I personally did not care if they thought I was an idiot or not. I'll straight up and say I don't know. I'll say this is what I think, but I have no idea. And generally my experiences that I had with any of the residents or attendings, they would just say, okay, well, this is what you're doing. This is what the answer is, or this is how you go about with the next step. And I'll just take it. Thank you. I appreciate that. I mean, they're not my teacher, and I don't have to feel embarrassed for asking a question in a learning environment.
Yeah.
If I am actually a resident or I'm an attending physician and I don't know these answers, that's different. Yeah. But I'm a student, and I'm going to take all of the privileges it has with being a student and asking questions and being okay with being in a learning position that I can now. So it's fine for me when I get pimped and they ask me a question. And I'm like, I don't know. Sometimes I do, and I surprise myself. But there's no shame. I have no shame with saying I have no idea.
Yeah, I mean, I didn't have shame about asking questions. And I'd say if anyone else is like about to do a surgery rotation, I'd say don't be afraid to ask questions. I've gotten some advice before being like, oh, don't speak unless you're spoken to. And I'd say unless you're like in a surgery, obviously don't interrupt the surgeon.
Right.
But in general, show that like intellectual curiosity. That's kind of a pretentious way of just saying like, don't ask like dumb questions or ask questions for the sake of asking it to appear like you're interested or engaged. But just if you're genuinely curious about something, just ask. And if it happens to be a dumb question, then so what? But if not, most of the times they'll be like, oh, okay, I'm glad you asked that. Here is why we do this.
I've heard some of our classmates have tried to go a little bit gung-ho and it hasn't worked out for them. And
I think they can pick up on that. If you're trying to be like a kissing their ass or something, like that, people can tell.
Yeah.
But if something comes up that is kind of like, oh, why do we do that? You ask. I think they appreciate it. They can recognize that you're engaged.
Yeah, that makes sense. I am a little bit more confident about what I want to do now that I've done surgery.
What do you want to do? I feel like I've heard different answers.
No. That's from others.
Okay.
I feel like I am a little bit more solidified with anesthesia now that I have been in the past. Like, I love surgery, and I think it's a really great profession. But I guess because I'm older and I want to actually have a life, I don't want to give all of my heart and soul into this one thing. Mm-hmm. And I think that based on how our system is set up, that you go into residency, you do 80-hour weeks, right? And you do that for 5, 6, 7, potentially 8 years.
Go back in research years too, because a lot of those ones that are really long want you to do research too.
Right.
And that was one thing that's eye-opening, is sometimes that time span you're kind of given, like prepackaged. A lot of residents I met, they'd taken a year off for research, things like that. So especially for people that maybe time is more important, they've got to factor in that it might not just be, I want to do neurosurgery, that's 7 years. It's like, well, if you want to do neurosurgery, you're probably going to be a scientist too. And that has extra time in it.
And there are people that love it. They really love the material, and they love every aspect about it. And I really do enjoy, medicine and helping and being with people on that level. But I don't love surgery enough to give the next decade of my life to only doing this one thing and putting every aspect of my personal or other professional aspirations in the back burner. And I commend those people who do it. Yeah. I just wish that the path to do surgery wasn't, I guess, not as demanding, right? If so, I probably would have taken it a little bit more seriously. But I enjoy anesthesia. I'm in the OR, but I don't have to be. I can assist with surgical operations, but I can also go in and work with people in the community if I want to. And there's this flexibility of being in a nice controlled environment, but as well as having access to a bunch of people in where they are in their own homes, that is really appealing to me. So I think that's why I like anesthesia. And you see immediate results. Like, someone's in pain. Yeah. After spending 15 minutes or an hour with them, depending on what the procedure is, their pain is either moderately reduced or completely gone. And that is just a nice input and reward system that I think was really going to keep me engaged in my level of care.
Gotcha. Okay. It's cool to hear. I mean, I know you liked anesthesia a lot. I feel like everyone that does an anesthesia rotation loves it. I've not met anyone that did it and didn't like it.
I hated it. It was the worst
thing. But I guess
ever.
it's so alien to me. I don't know. It's just something that I never even considered. So that's interesting to hear what anesthesia does.
Yeah.
Which might be obvious to people that are interested in it, but to me, the only exposure to it was in the OR. Yeah. So I don't really know what happened outside of that. I didn't realize there's things like clinics and everything.
Okay. You have access to people to do outpatient. They come in, they have this pain. There's nothing much anyone else can do, and you're there to help cure their pain. And it's not just giving a whole bunch of opioids and drugs. There are physical things we can do to manage someone's pain level. But it's not even just pain. Like in the OR, they're really concerned about respiratory rate, and they're kind of like the respiratory specialists in the operating room. And all of the other vital signs that the anesthesiologist is really in control of. And they have to manage so many things at one time, and I kind of like that aspect. But I mean, this about emergency medicine, so.
Yeah, I mean, I guess with emergency medicine, the exposures that I'd had before medical school, then in our surgery rotation, we can do some extra time in the emergency department if you're interested. So that's what I did. And that was just cool. I wouldn't say we had many people that you could immediately resolve things for them.
Right.
Because so many people come in with chronic issues.
Right.
But it was just very interesting, I guess, from an intellectual point of view, just the variety of things that come in, especially the GI disorders. I found quite interesting trying to differentiate from them. And I think just at my level as a medical student, because we can't really do that much. But with the GI disorders, I felt like physical exams were very helpful. Sometimes I felt like I was pretending to be a doctor in a way, do my physical. This is Rossing's. Oh wow, that was positive. Okay, let me
right.
let the attending know real quick. This is what's going on. But Yeah, I guess that was one thing that was pretty cool about surgery, is making like immediate solutions, I guess.
Yeah.
So you could follow up with someone the next day. They come in, something like horrible is going wrong. The next day, like post-op, and they're like, oh wow, I feel so much better. Like, thank you.
Yeah.
And that's pretty cool, like seeing that patient follow-up and seeing them being like pretty appreciative of it. Yeah. And just also seeing like, okay, wow, we like fixed this guy's issue.
Yeah.
I guess you don't see that too much in the ER, but I thought the pace of the ER was really fun.
Yeah.
And just the variety of things that come in. And I really liked the people I worked with. To be honest, I liked everyone I got a chance to like work with on all the rotations I was with.
Surprisingly.
But I thought the ER was like my favorite overall.
It was really fortunate that we've had almost universal great experiences with the people that we've worked with at all of the different sites we've gone to. I don't think I had a bad experience with any of my attendings or any of the residents. And I'm super fortunate for that. So that was really good. Hopefully this was enlightening for you guys. You learned a few things about what our experience was in our first clerkship rotation. Yeah. And it was surgery. So I hear it's like the second hardest. That's what I've heard.
I believe them when I say that, because it seemed like internal medicine was pretty intense.
Yeah. So we have that next. So yeah. So surgery clerkship is done. Hope you enjoyed the conversation. And fingers crossed, because we haven't got our results yet.
No results yet. Touch wood though, we good.
Yeah. Please like, comment, and subscribe. And see you next time.
All right.
Bye.